Good afternoon, Mr. Caskey. First of all...
Sorry, my lord, we can't quite hear you at the moment. It's not you, it was just very faint. Presumably.
Is it?
That's better now.
All right, that's fine. Sorry about that. First of all, say that obviously the last witness was not broadcast because of the restriction order, but those that are watching on the live stream are back, so they can hear us and see us again now. Apart from that, over to you, Mr. Caskey.
Thank you, my lord. The last witness for today is Pinar Aksu, and I'll begin by saying thank you very much for providing your witness statement, which we have. I understand you have a copy of the witness statement to hand.
Yes.
Would you tell the inquiry your full name, please?
Yeah, my name is Pinar Aksu.
And in what capacity are you here?
I'm here from Maryhill Integration Network.
Maryhill Integration Network. Yeah. Can you tell us basically what that organisation is?
Yeah, so we are a community development organisation based in Glasgow. We primarily support people who are seeking asylum and refuge, and we do a lot of direct support for people through outreach work, projects, weekly drop-ins, ranging from different activities, so like men's group, women's group, family group, as well as doing doing advocacy and human rights work, which is my field.
And the witness statement that you've provided details a bit more about that, and that for the purposes of the inquiry is under reference SCI WT 838501. Is the content, have you had the opportunity to go over your witness statement?
Yes, I did.
Is the content of it true?
Yes.
And are you happy for Lord Brailsford to have regard to it in considering how the inquiry should conclude?
Yes, yeah.
Paragraph 3 of the witness statement, you refer to the co-founding of Refugees for Justice. Can you just tell us about that?
Yeah, so that was after the incident at the Park Inn. A few of us had a conversation about what happened and what we could do to avoid in the future incidents. So we came together and we launched a manifesto, and then we worked with the people who were in the Park Inn Hotel to launch Refugees for Justice.
Okay. Now, at paragraph 4, you explain in some detail what it is that your organisation does. Could you have a look at paragraph 4, and can I just ask, is there anything in there that you want to expand upon?
Yeah, so a lot of our work is providing one-to-one support, and we have a lot of members who are currently in the asylum process and people who have received refugee status as well. And like I said, my role specifically is looking at campaigns and advocacy, so trying to voice people's concerns that they may have.
Okay. Paragraph 5, you talk about the pandemic striking and the extent to which your organisation moved online. Is that correct?
Yes.
And you then talk about hearing about people being moved into hotels. How did you hear about that?
We heard through our members, so because we had direct connection with our members, and we have around more than 100 people coming through the door on a weekly basis or more. So when we were contacting our members to check up on them to see how they're doing, to assess their needs, then they started to mention that some of them have been placed into hotels, and then especially some of the women from our women's group, we found out that a few of them were taken into the mother and baby unit.
Okay. Now, before those transfers happened from flats where people had previously been living, as we heard earlier, to hotels, were you made aware that that was going to be happening?
No.
And so far as you're aware, were other third sector partners informed before it began?
No.
Can I take you to the final sentence in paragraph 5? Could you just read that?
This was very disturbing for us to hear. If the third sector had been notified in advance, we would have been even better prepared to step in, plug the gap in services left by government.
Such as?
Services such as there was a lot of gaps that was needed to be in place, such as people receiving food, such as people receiving the mental health support for them, as well as the fact that during the COVID people were picked from their homes into hotel accommodations, and this is something that we absolutely did not support, and if we were made aware of it in beforehand, it would have been a concern that we would have raised with the relevant authorities.
You talk about providing digital equipment in paragraph 6. Why was that important?
Yeah, so because we had a lot of our services was drop-in and it was all happening in person due to the work we do, which is around building bridges with the communities and looking at integration of the people and doing a lot of ESOL classes. So we moved all of our provisions and our work into online. So things like ESOL classes, we had to arrange that to have tutors to meet with the learners, and for that to happen there had to be data, and for that to happen there had to be also digital phones, if not laptops, or some form of digital equipment for people to participate. And it wasn't only the ESOL classes, we had the advocacy support, that was the Min Voices groups, moved online as well as connecting people and calling them to check on them, because we had a lot of members who are single people, elderly and families, and people who have went through very tough journeys, and I think needing to connect with them and make sure that how they're doing and if they need anything else was really vital for us. So we needed to make sure that people had some form of support digitally.
But presumably there would be statutory bodies who had obligations to those people.
They may have some obligations, but from our members, which was at that stage, we had hundreds of people supporting, and nobody received any support, rather than maybe connecting with other charities who may started similar support as well. Okay,
paragraph 8, you talk about providing PPE. So far as you're aware, people in hotels, were they provided with PPE, masks, things like that?
No.
Mears didn't do that?
No. So what we did, if it's okay to expand on it, is we had a volunteer who was donated a lot of PPEs, and also they were sewing a lot of them. So once we started to engage with the members in the hotel accommodations, as well as people who were accommodated in the communities, we went and distributed lots of packs of masks for people. And we did that a few times to make sure that people had 2 masks so that they could reuse when one is being washed.
You talk in paragraph 9 of finding out of the death of Adnan. What impact did that have on your community, as it were, those dealing with Maryhill integration?
Yeah. So when we were providing the support to the people, it was one of our members who messaged me to say, I'm sorry.
Take your time.
It was one of our members who texted me to say that somebody in the Macleigh's guest house, which was accommodating asylum seekers in Glasgow, died a few days ago. So it's just bringing back memories. So when he messaged to say that somebody passed away, this was not picked up by any of the Mayor's officers, and it was not picked up by any other charities. And the person...
What do you mean it wasn't picked up?
It wasn't picked up as in it was not made aware that somebody died in an hotel accommodation. And then when the person mentioned to me, it was horrifying, and obviously it's not something that you hear very often. And then we were made aware that the same room was then a few days later accommodating another new asylum seeker in the hotel. This was, for me, as somebody who was providing support and our 4 members, it was one of the most dehumanizing things we have ever experienced. Just for there were several reasons for this. One of them was for the lack of respect for the person who lost their life, especially when we have raised this with mayors, and the lack of respect from the hotel staff who were working there on the ground, especially when we wanted to meet outside the hotel to remember the person who passed away, which was later on found that it was an suicide incident, and this person was a young person in their early 30s, and this was the first time we heard that the seriousness of placing people in hotel accommodations and the impact is having on people's mental health.
Okay. At paragraph 11, you talk about, I don't want to go through this in detail, but you talk about there being a vigil outside the hotel and a member of staff at the hotel being abusive. Was that kind of thing a unique experience? I mean, we can read what's said there, so I don't need to get you to go through that. Yeah,
so we thought again that because a life was lost, it would be good to go outside and have his friends coming out to put some flowers as well. So a group of us socially distanced, because at that time we had to be keeping the 2-meter distance. We just went and put some flowers on the ground outside, and then the hotel staff came out, and next to me was another colleague of mine, who's also from an ethnic minority background, and she just came next to us and said, you know, he's dead now, we have someone else in his room, and what you're doing here, I'm going to bend the flowers. And I tried to explain, look, we're just trying to remember the person who died, we're not doing anything harm on it. This is across the road from the hotel's property, it's not in your area. And she went to bend all the flowers and put everything away, which I found extremely, again, a manner that you wouldn't want to witness, somebody who's disrespecting a life that's been lost. And then she went on to say that these guys are very lucky, we have our own homeless people in the street, they're being fed in this hotel. And it was horrifying to hear this, because there were people staying in the hotel and they were watching us having this conversation, and it just made me question the support that they were receiving while this was a hotel staff who was working. Did you take
that up with the owners or Scottish Government? Or?
I tried to call the hotel, but when somebody picked up and when I tried to explain, they just said, "Oh, okay, we can't help you now," and they just closed the phone on me.
Did you contact Scottish Government about it?
I'm trying to think. We may have raised it with some of the MPs, but this is where we took it. And it was because when it happens at the moment, I just could not believe it happened, and I was trying not to escalate things, because there was some of the young men who lost their friends a week before and who were kind of witnessing this conversation, so I didn't want it to escalate any further at that moment.
Okay, you talk at paragraph 12 and 13 about school uniforms and school meals vouchers. And you also say in the earlier part of your statement that Maryhill integration set up in around 2000.
Yes, we were set in 2001.
Right, so can we come up to the 2020? Was there a particular issue with asylum seekers accessing school clothing grants in particular?
Before the pandemic, or?
well, was there an issue in 2020 during the pandemic? Was there a problem then?
So we had a few of our members contacting us to say that when they applied for the school uniforms, for the sport, for the meal and the uniform, they weren't able to access it because usually the council gives some form of a sport where you need to take it to your bank account and then withdraw the money. But because asylum seekers can't have a bank account, so a lot of people were excluded from this.
And in previous years, had that been a problem?
No, as much as I'm aware, we didn't have any of our members raising it with me.
Right. So how did you manage to resolve the problem? Or did you manage to resolve it, and if so, how?
So what I did was I emailed our local MP on behalf of our member because they were living in the north side of the city, and I've explained the situation that we have a member who's trying to receive this support. Is there a way you can email the Glasgow City Council? So the MP emailed the Glasgow City Council to raise this issue. And what I went back to my emails and checked, and what the council did eventually was they provided checks for the families, where then they were able to go to allocated bank to cash the cheque that was provided for them.
Right, and so that was in 2020. Did that problem recur in 2021?
Yes, we had the same problem with the same person and a few other people who, again, raised the same concern for us.
And did did Glasgow City Council not remember what had happened the year before?
No.
No?
No.
Were you able to just point to the previous correspondence?
So I emailed the MP again, and I raised the issue that we're experiencing the similar concern as last year. Would you be able to support again? And the MP got involved again, and then gradually some of the families were able to receive the support.
Okay. Paragraph 15 and on, you talk about the mental health impacts. Tell me, paragraph 15, it says, tragically many members indicated signs of contemplating suicide or said they felt suicidal during the pandemic due to the isolation they were experiencing. Can you tell us a bit more about that?
Yep, so I had a few incidents when we were having our Zoom call, when we were doing check-ups on each other and just talking about how everyone is feeling, and people were very open about saying that staying indoors for a long period of time is not helping with their mental health, and we had a few members who said that they feel suicidal. So we picked this up and we tried to signpost them to different organisations, but unfortunately we didn't get anywhere with this. So
when you say different organisations, who are you talking about?
So at the time we tried to contact the mental health organisations, and then we had produced some numbers for the key online support and just passed the numbers to members. And we didn't get far with this due to the waiting list for mental health support. So what we then decided to do was we decided to call our members on a weekly basis just to check up on them, to see how they're doing, just to be a listening ear for them so that they can share their concerns.
Paragraph 16, you talk about setting up a group for counselling sessions.
Yeah, so eventually when we saw that we had a few members who we were significantly worried about, we then decided to arrange a counselling session. So we partnered with a university to have a student to come into the premises and to support some counselling sessions for the members, which was very limited. It was around 5-6 people that benefited from it.
Were you able to do anything for those who weren't in the group in terms of getting information or assistance from them, from the City Council, the Health and Social Care Partnership, anywhere like that? Were they involved in, for example, outreach work?
In terms of trying to get them the right support, so again, we collected some numbers of phone numbers for organisations who does mental health support. So we would usually pass on that to our members, and if they needed additional support, like with language or for us to do on behalf of themselves, we would do that. But then we were told, due to the waiting list, that they were, it's a long period, and then we were. In a way, try to support our members by direct them to be more active in the online meetings and more active in calling us back, or when we call them, try to answer the phone and speak with us. So we were trying to find different means so that people were not left alone and isolated.
We heard evidence earlier that when people are moved into hotels, their money effectively stops, or it goes down to a very small amount of money. In paragraph 18, you talk about transport problems, particularly in relation to someone who had been taken to hospital by ambulance. Tell me about that.
Yep, so the limited asylum support that's given to people, it was barely enough to survive on anyway. So whether that was to buy clothes or buy essentials and the food, and usually when people do receive the money in an Aspen card, during the lockdown, if people had to travel far, so let's say they had to take the bus to go to a bigger shopping centre, a shopping place like Tesco or Asda, because things there are more cheaper, so they would be able to spend the money more wisely. But then, because they didn't have, the buses weren't running as often, so then they had to use the corner shop, and it meant that the limited money they had, around £35 to £37, it was just being spent so much quicker than they would if they went to a bigger shopping place. So we had cases where people indicated that the amount of money that they were receiving was not enough for them to use the transport, or we had cases when people needed to go to hospitals and they need to take the taxi, and again they didn't have enough money for that. And there is in the NHS in Scotland, people can claim their money back, but we tried to support some of our members to do through that process, and we didn't get anywhere, unfortunately. There was just far too many obstacles in that for someone who's in the asylum process to claim back their money. And in the first instance, people don't have the money to take the taxi unless they were contacting a charity to get that support.
Paragraph 18, you talk about someone being taken to the hospital by ambulance, and then you having to go and pick them up to get them home. Tell me about that.
Yeah, so this was one of our members who experienced a dawn raid, and who was literally, I would say, dumped in the hospital, and then he did not have anything on him, no amount of support on him, and he called us to say that he needed to get home, but he didn't know how because of the confusion he went through as well, and then we had to go and pick him up with my colleague and take him back home. Okay.
Paragraph 19, you talk about impact on education, and in particular digital poverty for families with children. Mm-hmm. Tell us about that, please.
Yeah, so we had, again, especially for learners of ESOL, for them to access that support, they needed either some form of a laptop or some form of Wi-Fi to connect to the internet. And the same similarly went for the children as well. Because the children of asylum seekers, they go to school, and they're able to access the support there, and then there isn't a much great need of Wi-Fi in the house. But during the pandemic, they were in the house and they were stuck, and there wasn't a lot of things to do, so they had to either go on the laptops, or they wanted to watch something, and again, there is no internet in the house. So we had a lot of our members contacting us to say that we're trying to support our children, but we're not being able to support that. And again, because of the limited asylum support as well, they weren't able to buy things for the children to keep them busy. And I'm sure people who have children knows that it's very hard to entertain them. Mm-hmm. So that was one of the things that
were you able to access any of the facilities that the Scottish Government made available?
Yep, so to start with, we initially tried to allocate some funds and some data and some using dongles as well. And gradually there was the Connecting Scotland scheme. So we applied that, which provided some dongles for internet and some Chromebooks for the members. So we were able to distribute that into different families and single people.
Okay, paragraph 20, you talk about the mother and baby unit. Yeah,
Yep.
we heard quite a lot of evidence about that earlier today. What I would like you to tell us about is your experience of the mother and baby unit.
Yep, so we were first made aware of this when some of our members, that when we were distributing food, we were aware that some of the women, they either had a newborn a baby or they were pregnant. And during one of the distributions, when we were calling people up to say we're on our way, one of the moms said, I'm not in my address, I've been moved to mother and baby unit, and we weren't too sure what that was. And then
had you been contacted in advance of it opening to be told about it?
I meant contacting our member to say we are going to drop off the food to you.
No. Had you been contacted before that phone call took place by anyone to say there's now a mother and baby unit going to be opening?
No, we weren't. We were made aware through our members to say that they've been moved into the mother and baby unit.
Okay.
So that was one, and then some of our members in the women's group, again, they stopped attending the Zoom meetings, and we got quite worried. So when we tried to call them, then eventually we found out that it's because they were being transferred and moved into the mother and baby unit, and that's why we're made aware of it.
And did you visit the mother and baby unit?
Yes, so me and my colleague, when we were doing our weekly drop-offs of parcels, we had a few mothers who indicated they needed some additional support. So we brought things like nappies, especially little baby clothes, and some sanitary products for the mothers. So we were able to go into the mother and baby unit. And I think for me, when I went in, this was again when it first opened. I just walked in and nobody asked who I was, which organisations I was coming from. There was as much as I was aware, nobody said, can you sign in here to say, this is who you are. And that for me was quite a concern, because it made me feel that anyone can just walk in.
Was that simply a one-off, or was that part of a pattern?
I visited several times, and the times that I went there was no one in the reception, so I just walked in and I stood there to look around to see if somebody will come and ask, who are you? But no one did, and so it was several times.
What view, if any, did you form about the training that had been given to the staff?
It's incredibly worried me that there wasn't a lot of training provided to Mayor staff, especially around equality, around mental health, as well as trying to provide the support people might need while they're being accommodated in the hotels.
And was the mother and baby unit operated by Mayor staff?
Yes. Yeah.
Okay. I'm now on page 7, which is paragraph 22. You talk about dawn raids. This is really the last thing you talk about. Now, it's important to understand that this inquiry is looking at the Scottish Government's response, not reserved matters such as removals from the UK. But when a detention early in the morning happens, what is your experience, or what was your experience of that during lockdown? Was that happening during lockdown?
Yes. So the person we mentioned here, they're a member of our group, and I remember that day I received several phone calls from our members. And eventually, when I answered the phone, our members mentioned that the family had experienced a dawn raid, and now that he was left alone in the hospital, and that's when he didn't have any means to travel. So that was the way it was brought to our attention, which was really shocking for us because it was on the day of Eid, and it was on a Friday, very early morning. And we thought that the practice of dawn raid has stopped, and we thought again that it would not happen, especially during that time when it was under the COVID-19 provisions of for us to be, measuring some steps.
Okay, now we know approximately when was it on first? I don't know the proper name. Was it first Eid or second Eid?
It was at the end of the
end of the.
Yeah, so it was celebration time.
Yep. The dawn raid happens. Do you know if by that point, where was the person from?
Apologies, I'd like to say that the Eid I was referring to is actually the one in May, Kenmure Street. The one I'm thinking about was at the beginning of the Ramadan, so
right.
I would just like to correct that. So this was at the very beginning of the Ramadan when people were fasting.
Right. At the point at which it happened, do you know where was the person from?
Yeah, so it was picked up by the media later on as well, so the person from Pakistan.
Right, and at the time when the dawn raid happened, do you know if removals to Pakistan were happening? At that point, do you know if Pakistan was still on the red list?
I don't think I have that information if it was on the red
That's
list.
Fine.
However, we do know that there was several other dawn raids that took place from December 2020 up until April when this dawn raid happened.
So far as you recall, and I'm talking about during lockdown, was this the last of the dawn raids? Were there any after it, so far as you're aware?
So this one was the one that was made to our attention, and then there was another one, and that's the one that was at the end of the Eid, which took place in May.
That was the well-known Kenmure Street incident.
Yeah, that was the second one. Yeah.
Okay. A second. You say at paragraph 24, although the Home Office was responsible for many of the decisions we have worked to campaign against, the Scottish local authorities were in a position to respond better to the needs of our members on the ground and in areas of education, transport and health. Where they do not do so, the charity sector had to step in to help. I don't want to ask you about the Home Office, that's not for us, but I do want to ask you about Scottish local authorities. How could they have responded better?
So just going back into the area of education, when people were again placed in the hotels and when they were accommodated in the houses, one of the other things we've seen, the ESOL classes was one thing. Accessing the learning opportunities was really difficult due to not having any digital support. Transport and health was another area. As mentioned, there is a scheme within the NHS Scotland that people can claim their transport costs, but we weren't able to do that when we were advocating on it. The other area, when it comes to health, we were made aware that the members who were moved into hotel accommodations, for them to access health concerns and such as registering with a GP or for them to get the support they needed was not made available for them. We then had some incidents where we had witnessed new families being placed into hotel accommodations and they were not registered with our school and they were at the age of being registered with our school. And we were again made aware when the family contacted to say, it's been a few months, what do we do? do we just go and register? How does this work? So they were not informed by anyone to say that this is the process and this is the way children are enrolled into school. And we felt that if these provisions were, some form of provisions were in place, and if people were not left behind, then adequate support would have been in place.
Okay. I think those are all the questions I wish to ask you. Is there anything important that you haven't said to the inquiry that you want to say?
Yes. I would like to mention a few points, especially the concern around mental health. We've seen this so many times with the suicide that happened at Maclay's Hotel and the incident that happened in the parking as well. And this is an area that is not stopped and it's an ongoing concern. Just last week we had one of the members that we were supporting took his own life, and this person is in a hotel accommodation. So 4 years on since the pandemic, the provision of hotels are still being used. And the lack of support, whether that's in mental health, is still not in place for people who are seeking asylum and refuge. Again, especially those in hotels. The increase in racism, I would like to briefly mention up on that as well. We try to work so that people feel welcome in communities and people have opportunities for integration. However, placing hotels into rural areas without adequate support put in place by local authorities in Scotland contributes to people not being able to feel part of a community, as well as access services, such as if they were to register for colleges or register for ESOL classes, as well as the increase in racism. There has been where we've been made aware that far-right groups have been protesting outside hotel accommodations. And this has been going on since the pandemic. And until this day, there is no reason about why these far-right groups are targeting outside the hotels. What will happen if a member from this far-right groups kills an asylum seeker? Who's going to be responsible for this? We know that immigration is a reserved matter. However, the policing in Scotland is not, and these far-right groups are in here. And the welfare of people in Scotland should be under the provisions in Scotland as well. And when it comes to people receiving support for integration, again, we're seeing that in hotel accommodations, there are not adequate support mechanisms put in place, and local authorities are made aware of where these hotels are being opening, as they were made aware back in during the COVID-19 as well. And yeah, just to end to say that since the parking incident, more than 100 people committed suicide and passed away in some form of asylum accommodation across the UK. And to witness that in Scotland, in our communities, and to continuously see the deteriorating of people's mental health is very hard on charities and on individual level. And I don't think anyone who is in Scotland should experience that.
Okay, thank you very much.
Thank you.
Thank you.
Yes, thank you, Ms. Aksu. And that brings an end to today's hearings. And we'll
rather earlier than planned.
Yes, I'm very grateful for that. Sure, everyone else is. 9:45 on Tuesday morning.
I think that's correct, Lord.
Very good. Thank you all.